A loud breather.
You're also a loud breather.
Yeah.
When you say loud breather, what do you mean?
I don't know. When I'm like near people can always hear me breathing.
Okay.
They've told me about that.
Okay,
before.
so this is an exercise for you. This is a new exercise. And you are, some people that have narrow noses, like I've never wanted a bigger nose in my life, and now I want a big one. I had a deviated septum surgery last year because I was bent, and guess what? No injury. This is the way you breathe. If your tongue, let me show you a little bit about the tongue. If the tongue does not rest up on the palate, and that's why I'm gonna bring in the tongue right now. Tongue is never talked about in breathing, and it should be. Your tongue, it fits so perfectly up here. But guess, sometimes our tongues don't fit in our mouths because we're narrow jawed. And it's because of the way you breathe when you were growing from a child to an adult. So your tongue, I want it to kind of say N and then close, and so it's filling here. So the pressure of the tongue when you're a growing child spreads it wide. When that tongue goes down and you end up mouth breathing, anybody know that they're mouth breathing? Close your mouth, everybody. So if you know that your mouth is open sometimes, especially in the morning, and it's dry mouth, you're mouth breathing all night. So I want you to know that if your tongue goes down, this is what ends up happening to your palate. It goes high and narrow. So I'll do a little screen of whoever's in here in this chair getting tested. I'll tell you what I see. But I have a high, narrow palate because I was tongue-tied. People that were tongue-tied, the tongue gets tied down to the bottom of the floor of the mouth, and then it can't reach there to spread it. So sometimes we get intercepted as an infant. Sometimes mom goes straight to a bottle. You never know. And what ends up happening is a narrow cavity for nasal breathing. And what happens when you can't nose breathe well? Your mouth opens. So I've optimized what I have. I've had a nasal surgery, but I know how to decongest my nose and keep it open. And you can do it. Sometimes foods get in the way. Sometimes food allergies plug us. Sometimes wine plugs us. So know what your allergy is and avoid it when you really need to perform. Okay? All right. So